Did you know that something as simple as garlic, yes, that little clove sitting in your kitchen, could either protect your heart or quietly trigger a stroke? You've probably heard your whole life that garlic is one of nature's greatest healers. And that's true, but only if you use it the right way. But here's the problem I see all the time in my practice. Seniors who try to be healthy, but unknowingly make one small mistake with garlic. And suddenly their blood pressure crashes, their medication stops working, or worse, a brain bleed occurs while they sleep. You see, after 60, your body processes garlic very differently. Your liver slows down, your blood vessels thin, your medications interact in ways you never had to worry about before. And that means the same garlic that helped you in your 40s could hurt you today. I've treated patients who thought they were doing the right thing, taking garlic for their heart, their blood sugar, their immune system. But one simple habit turned into a life-threatening emergency. That's why today I want to walk you through the 6 most dangerous garlic mistakes older adults make and how to avoid them. Mistake number 2, it could be damaging your brain slowly, day by day, without you even knowing. So please, stay with me. This video could save your life or the life of someone you love. And before we begin, hit the like button if you care about brain health and subscribe for weekly videos just like this. If you're watching now, type 1 in the comments to let me know you're here. Ready? Let's begin. Mistake number 6, storing garlic and oil the wrong way. A silent killer in a jar. Garlic-infused oil might sound like a healthy, flavorful kitchen upgrade. But if you're over 60, storing garlic and oil the wrong way can quietly turn into one of the most dangerous mistakes you'll ever make. I remember a patient of mine, Mrs. Dorothy, 74, from Kansas. A passionate home cook, she believed in natural remedies and loved preparing her garlic oil. She'd chop up fresh garlic, pour in extra virgin olive oil, and leave it sitting on her kitchen counter for daily use. What she didn't realize was that she was creating the perfect breeding ground for a deadly bacterium, Clostridium botulinum. Now, you might not be familiar with this name, but I can tell you it's terrifying. It causes botulism, a rare but life-threatening condition. This bacterium thrives in low-oxygen environments, exactly like garlic submerged in oil. And the most chilling part? The toxin it produces has no smell, no taste, no warning signs. Within 24 to 48 hours, symptoms can begin subtly: blurred vision, dry mouth, difficulty swallowing. But then it gets worse. Muscle paralysis begins to spread, and for seniors, this can lead to respiratory failure while asleep. Recovery, if possible, is long and uncertain. And in someone over 60, often there isn't a second chance. But here's the good news. Prevention is simple. If you enjoy garlic oil, always refrigerate it and use it within 7 days. Better yet, roast whole garlic cloves at 300 degrees for 45 minutes, then strain into oil and store in the fridge. Roasting kills any harmful bacteria and adds depth of flavor while protecting your aging digestive system. Never store garlic and oil at room temperature. Ever. Because after 60, something as simple as a homemade oil can become a fatal mistake. Protect your brain, your lungs, and your life, one garlic clove at a time. Mistake number 5, combining garlic with diabetes medications. When two good things become dangerous. Garlic lowers blood sugar, so do diabetes medications. But when you mix the two without proper guidance, the result is not support, it is risk. Let me tell you about one of my patients, Mr. Richard, age 71, a retired engineer from Texas. He had managed his type 2 diabetes well for years using metformin. Recently, he read online that raw garlic could help lower blood sugar even further. So every morning, he began eating 2 raw cloves of garlic with his medication. At first, he felt great, more energy, clearer focus. But by the second week, everything changed. One morning, his wife found him unresponsive on the bathroom floor, drenched in sweat, hands ice cold. At the hospital, his blood sugar had dropped to just 42 milligrams per deciliter. He had entered a state of severe hypoglycemia while sleeping. If his wife hadn't found him in time, he may not have survived. So why does this happen? Garlic, especially raw garlic, increases insulin sensitivity. It makes your body absorb sugar into your cells more quickly. Combine that with medications like metformin, insulin, or sulfonylureas, and your blood sugar can drop too fast, too far. You might not feel it coming. You could faint, have a seizure, or fall into a coma, all while your body sleeps. Now, this doesn't mean people with diabetes should never eat garlic. It means you must use it the right way in the right amount. Here is what I tell my older patients. Never eat raw garlic on an empty stomach. Always consume garlic with meals to slow its effects. Start with just 1 clove per day and monitor your blood sugar for 2 full weeks. Most importantly, tell your doctor if you're adding garlic to your routine. Garlic can support healthy blood sugar, but at your age, there is no room for guesswork. Adjust slowly, carefully, and always prioritize safety. Mistake number 4, eating raw garlic on an empty stomach. When garlic becomes fire for an aging stomach. Raw garlic is often praised as a natural antibiotic. Many older adults have been told, just eat garlic first thing in the morning. It boosts immunity and cleanses the body. But for a stomach that's been through decades of wear, perhaps some ulcers, or just slower digestion, this simple act can quietly become a spark that lights a fire. Let me tell you about one of my patients, Mrs. Cuck, age 69, a retired elementary school teacher. Gentle, thoughtful, and health conscious, she started eating 2 raw cloves of garlic every morning with a glass of warm water on an empty stomach. After about a week, she began experiencing sharp, stabbing pains in her upper abdomen. Then one morning, she vomited blood. At the hospital, doctors found a bleeding ulcer in her stomach, and it had perforated. The direct cause, raw garlic taken alone on an empty stomach. You see, garlic contains powerful sulfur compounds like allicin. These stimulate stomach acid and can strip away the protective mucus that lines your stomach wall. In younger people with strong digestion, the body may bounce back. But after 60, just one wrong move can trigger bleeding, inflammation, or worse, emergency surgery. And it's not just ulcers. If you've ever had acid reflux, gastritis, or conditions like Crohn's or colitis, raw garlic can trigger weeks-long flare-ups, even hospital stays. So here's what I tell my older patients. Never eat raw garlic on an empty stomach. Pair it with soothing foods. Plain yogurt, soft bread, or porridge help neutralize the acid. If you still want daily garlic, consider roasting it gently, using aged garlic extract, or even trying black garlic, which is fermented and gentler on your gut. A safe home method, crush 1 clove of garlic, let it rest 10 minutes, then stir into a spoon of honey and warm water. The honey protects, the water dilutes, and you still get the benefits. Your stomach has served you for a lifetime. It doesn't need a challenge, it needs kindness now. Mistake number 3, eating garlic before surgery. When 1 clove turns a simple procedure into a nightmare. Most people don't realize that garlic is a natural blood thinner. That's one of the reasons it's good for your heart. But that same property can make even a minor surgery dangerous if you eat garlic too close to the procedure. Let me share a story about one of my patients, Mr. James, age 76. He was scheduled for a routine gallbladder removal. He was active, in good spirits, and all his pre-op tests looked perfect. But as the surgery began, something went terribly wrong. His blood wouldn't clot. The bleeding wouldn't stop. The doctors had to extend the operation by 2 hours and perform an emergency transfusion. Later, they discovered the cause. Mr. James had been taking garlic supplements every day for the past 2 weeks to help with his cholesterol. Garlic inhibits platelet aggregation and interferes with clotting mechanisms in the blood. For older adults whose blood vessels may already be fragile, even minor bleeding can lead to serious drops in blood pressure, fainting, or worse. And here's what makes it more dangerous. If you are also taking aspirin, vitamin E, fish oil, or prescription blood thinners like warfarin or apixaban, garlic's blood thinning effects multiply dramatically. Some documented cases include brain hemorrhage triggered by nothing more than garlic bread the night before a dental procedure. So if you are over 60, please remember this. Stop consuming garlic and garlic supplements at least 10 days before any surgery, even minor ones like dental cleanings or colonoscopies. Always inform your doctor or surgeon about your garlic intake, even if it seems small or unimportant. If surgery is an emergency, tell the team immediately. They can prepare clotting agents and blood products in advance. One clove of garlic may not hurt a young, healthy person. But in a body that's carried you for decades, even the smallest things matter. Your safety is worth the precaution. Mistake number 2, eating too much raw garlic daily. When medicine turns into poison, garlic is good, but more garlic does not mean more benefits. Over the past few years, I've seen a concerning trend spreading online. Many older adults are being told, eat a whole bulb of raw garlic every day. It detoxifies the body, prevents cancer, boosts the immune system. They push through the burning taste. They ignore the stomach cramps because they believe more is better. What they don't realize is that they may be slowly poisoning themselves. One of my patients, Mrs. Helen, age 68, came into my clinic pale, weak, and complaining of dark urine. After some testing, we discovered she was suffering from hemolytic anemia. Her red blood cells were being destroyed faster than her body could replace them. Why? She had been eating up to 20 raw garlic cloves a day for a week. The culprit was allicin, the main active compound in raw garlic, which in excess becomes a powerful oxidizing agent. It literally breaks down your red blood cells. But that's not the only danger. Patients who consume large amounts of raw garlic can suffer chemical burns in the esophagus. I've seen cases where people needed endoscopies because garlic caused ulcers, internal bleeding, and scarring that made it difficult to swallow solid food for months. Here's what I want every older adult to know. The safe amount is 1 to 2 cloves of raw garlic per day, always eaten with food, not on an empty stomach. If you want to increase the dose, do it slowly, watch how your body reacts, and talk to your doctor first. If you experience burning in your chest, bloating, or dark-colored urine, stop immediately and seek medical help. After 60, your body is not as forgiving as it once was. You don't need to overwhelm it. You need to nourish it, gently and consistently. Mistake number 1, taking garlic with blood-thinning medications. When silence becomes a tragedy. This is the most dangerous mistake, and sadly one I've seen far too often in over 3 decades of medical practice. Not because people are careless, but because they simply don't know that something as innocent as garlic could interact with the very medication keeping them alive. Let me tell you about Mr. Tan, age 73, a retired firefighter. He was on warfarin to prevent strokes caused by atrial fibrillation. At the same time, he started taking garlic supplements. He had heard it was good for the blood, good for cholesterol, but he didn't tell his doctor. 3 weeks later, he suffered a brain hemorrhage while sleeping. No injury, no fall, just a blood vessel in his brain that could no longer clot. He slipped into a coma and passed away 2 days later. A tragedy that could have been prevented if he had just mentioned he was taking garlic. Garlic is a natural blood thinner, but when combined with medications like warfarin, clopidogrel, apixaban, or even aspirin, the effect doesn't just add, it multiplies. The body loses its ability to form clots. People have lost vision from a retinal bleed after eating garlic bread. Others have bled into joints or muscles after bumping into furniture. These are not rare events. So if you are taking any blood-thinning medication, do not use raw garlic, garlic supplements, or black garlic unless your doctor specifically says it's safe. Garlic used in regular cooking may be acceptable, but only in consistent, modest amounts. Always tell your doctor every time about any garlic product you consume. I know many of you don't want to bother your doctor with something so small, but please do not stay silent about what you eat, because sometimes silence is what causes the irreversible. We've just uncovered the 6 most dangerous mistakes people make with garlic, but that's only the tip of the iceberg. There's still so much more to learn about using garlic safely, choosing the right type for your age and condition, and avoiding hidden medication interactions that most people don't know about. If you truly want to use garlic to support your health after 60, don't miss the next videos in this series. I'll walk with you step by step, slowly, safely, and with confidence. Number 1, how to use garlic safely after age 60. Protect the benefits, avoid the risks. Garlic is one of the oldest natural medicines known to humanity, but after the age of 60, our bodies change. What once brought benefits can now be too strong, too harsh, or even interact dangerously with medications. The key is not how much garlic, but rather how to use it wisely. Method 1. Always eat garlic with a main meal. Raw garlic on an empty stomach can burn your throat, irritate your stomach, or worsen conditions like ulcers or acid reflux. It's best to eat garlic with meals that contain healthy fats, such as olive oil or avocado, to help your body absorb its active compounds more effectively. Method 2. Don't eat freshly chopped garlic right away. Many people chop garlic and eat it immediately, not realizing they're missing most of its medicinal power. When garlic is chopped, it needs time, about 10 minutes, for the enzyme alliinase to convert its compounds into allicin, the active healing agent. Give it time before eating to unlock its full potential. Method 3. Use gentle cooking to reduce irritation. Lightly roasting, steaming, or sautéing garlic with olive oil can reduce its harshness while keeping most of its benefits. For seniors with sensitive digestion, this is often the safest and most effective way to enjoy garlic daily. Method 4. Keep your dosage consistent and observe your body. 1 to 2 cloves per day is more than enough for most older adults. If you're just beginning to use garlic for health, start with half a clove daily. Watch for any reactions. If none appear after a week, you can slowly increase. Never jump to high amounts at once. Method 5. Know when to pause. If you experience stomach pain, diarrhea, dark urine, dizziness, or fatigue after eating garlic, stop immediately and speak with your doctor. These are not signs of detoxing. They are your body's warning signals. After 60, unusual symptoms deserve attention, not dismissal. Method 6. Avoid taking garlic late in the evening. Garlic may increase acid reflux and disturb sleep if taken close to bedtime. Mornings or lunchtime are best. If taken later in the day, combine it with foods that help balance acidity, like cooked vegetables, porridge, or yogurt. Method 7. A simple and safe daily garlic recipe. Here's what I often recommend to my patients. Crush 1 garlic clove, let it rest for 10 minutes. Then mix it with a spoonful of extra virgin olive oil. Spread this on whole grain bread or steamed vegetables. It's heart healthy, gentle on the stomach, and all to enjoy. At this stage of life, your body doesn't need shocks. It needs rhythm, nourishment, and attention. When used wisely, garlic becomes a gentle, powerful ally for longevity. Number 2. Garlic and dangerous drug interactions. When natural meets pharmaceutical. Garlic is food, but in many ways, garlic also acts like medicine. And that's where the story becomes more delicate. After the age of 60, most of us are on at least 1 daily medication for high blood pressure, diabetes, heart disease, digestive problems, or bone health. Garlic, once it enters your body, doesn't care whether you're eating it for flavor or healing. It behaves like an active compound. And if you're not paying attention, that natural remedy can interact with your prescriptions in dangerous ways. 1. Garlic and blood thinners. The silent bleeding risk, if you're taking aspirin, warfarin, clopidogrel, or apixaban, adding raw garlic or garlic supplements can intensify the blood thinning effect to dangerous levels. This can lead to nosebleeds that won't stop, retinal bleeding, or even internal hemorrhage. In some cases, just a small bump on furniture led to massive bruising or emergency bleeding. Garlic reduces the body's ability to clot, and when combined with medication, the risk multiplies. 2. Garlic and diabetes medications. Sudden blood sugar crashes. Garlic naturally lowers blood sugar by increasing insulin sensitivity. That's helpful unless you're already taking drugs like metformin or insulin injections. The combined effect can push your blood sugar too low, causing confusion, dizziness, or even loss of consciousness. There have been reports of older adults found unresponsive in bed due to severe nighttime hypoglycemia triggered by garlic. 3. Garlic and high blood pressure meds. Too much of a good thing. Some seniors use garlic supplements along with drugs like amlodipine or losartan to lower blood pressure. While garlic can help open blood vessels, combining the two without supervision can cause your pressure to drop too far. The result? Sudden dizziness, falls, and reduced circulation to the brain and heart. 4. Garlic and stomach medications. Irritation and reduced effect. If you're using medications to protect the stomach lining or reduce acid, Raw garlic may work against you. It can increase irritation or reduce how well your medicine works. This is especially risky if you have a sensitive digestive system or a history of ulcers. 5. Garlic and antibiotics. Altered drug metabolism. Garlic may interfere with the enzymes in your liver, affecting how quickly your body processes certain antibiotics. Taking high doses of garlic during antibiotic therapy should only be done under close medical guidance. So how can you use garlic safely when taking medication? Always tell your doctor if you use garlic regularly, even in food. If you want to take garlic supplements or extracts, get approval and regular monitoring from your healthcare provider. Avoid sudden changes in how much garlic you consume. Stay consistent and observe how your body responds. Watch for signs like unusual bruising, blood in urine or stool, extreme fatigue or lightheadedness. These may be signs of interaction. Stop garlic immediately and seek medical advice. Garlic isn't dangerous, neither are your medications. But together and without proper guidance, they can create real harm. Number 3, raw, aged, or black garlic. Which type is right for seniors? You may have heard about raw garlic, aged garlic, or even black garlic, but few people understand that each type behaves differently inside the body, and not every form is ideal for seniors. Choosing the right type of garlic can help you absorb its full benefits while avoiding discomfort or side effects. Type 1, raw garlic, powerful but harsh on the stomach. Raw garlic is rich in L-lysine, a compound known to reduce inflammation, fight bacteria, lower blood pressure, and improve cholesterol. However, it can also irritate the stomach lining, trigger heartburn, or cause bloating, especially in older adults or those with digestive issues. If you wish to use raw garlic, always crush or chop it and let it rest for 10 minutes before eating. Then cook it gently or mix it with olive oil to soften its effects. Avoid eating raw garlic on an empty stomach, particularly if you have acid reflux or ulcers. Type 2, aged garlic, milder but still effective. Aged garlic refers to garlic that has been dried and stored over time. Its compounds are less aggressive, making it gentler on the stomach while still offering many of the same heart-healthy benefits. For seniors who want to maintain a regular garlic habit without the intensity of raw garlic, this is a solid middle ground. Type 3, black garlic, sweet, soft, and ideal for older digestion. Black garlic is made by fermenting raw garlic in controlled heat and humidity for several weeks. This process reduces the irritating compounds while nearly doubling its antioxidant content. It has no sharp taste, no odor, and is easy to chew and digest. For seniors, especially those with sensitive stomachs, liver or kidney issues, or those on long-term medication, black garlic is often the safest and most enjoyable choice. However, it doesn't offer the same antibacterial strength as raw garlic, so it's best used alongside or in rotation. Type 4. So which type is best for you? If you're generally healthy, have strong digestion, and are not on blood thinners, properly prepared raw garlic is fine. If you have a sensitive stomach, take chronic medications, or want to support liver and kidney function, choose aged or black garlic. If you're just starting with garlic, begin with black garlic, then gradually explore others as your body allows. Type 5. Try rotating your garlic use for lasting results. Consider using gently cooked raw garlic for 10 days, then switch to black garlic for 3 days. This gives your body a rest while still maintaining garlic's protective effects long-term. Each type of garlic is like a different kind of medicine. When you choose wisely, your body will respond with balance, comfort, and noticeable improvement. Don't just follow trends, follow what your age and condition require. Number 4, garlic and brain health, memory, mood, and the aging mind. When we think of garlic, we often associate it with heart health or immunity, but garlic also has a quiet yet powerful impact on one of the most precious organs we have, the brain. After age 60, memory may fade, moods may shift, and concerns about cognitive decline or dementia often arise. The good news is that certain compounds in garlic, when used properly, can gently protect and support your brain's function, naturally and effectively. 1. Garlic improves blood flow to the brain. Allicin, garlic's signature compound, helps widen small blood vessels in the brain, improving circulation and oxygen delivery to nerve cells. A study from the University of Louisville found that older adults who took garlic daily for 3 months had 21% better cerebral blood flow compared to a control group. Healthy blood flow is the foundation for mental clarity, energy, and balance. 2. Reduces neuroinflammation, a key factor in dementia. Chronic inflammation is a major contributor to cognitive decline. A Japanese study found that black garlic, rich in S-allylcysteine, suppressed inflammatory cytokines in the brain and helped prevent neuron damage. In simple terms, garlic not only cleans the blood vessels, but also helps calm the brain's internal stress, creating a more stable environment for your thoughts and memory to thrive. 3. Supports a mood and better sleep. Garlic helps regulate neurotransmitters like serotonin and dopamine, which influence mood and sleep quality. Regular garlic users report fewer unexplained mood swings, less anxiety, and more restful sleep. And for seniors, a good night's sleep and emotional steadiness are some of the greatest gifts each day can bring. 4. Combine garlic with key brain-supporting nutrients. For maximum brain benefit, garlic should be paired with omega-3s from fatty fish or flaxseed to protect nerve insulation, vitamin B12 for nerve repair and cognitive clarity, vitamin D3 to reduce inflammation and support brain signaling. Try a nourishing lunch of roasted garlic, grilled salmon, leafy greens, and a drizzle of olive oil. It's not just heart smart, it's brain smart too. 5. Best timing and dosage to support cognitive function. Take garlic with breakfast or lunch when absorption is most efficient. 1 to 2 cloves per day, cooked or mixed with olive oil. Follow a 10 days on, 3 days off rhythm for long-term benefit. Pair with light walking or daily breathing meditation to activate brain circuits. After 60, we don't need the memory of our youth, but we do cherish a clear mind, a calm mood, and this ability to remain ourselves. Garlic, used wisely, can become a quiet ally in preserving that inner clarity. Garlic is a precious gift from nature, but as we've learned, the real key lies in how you use it. After 60, everything you eat, every pill you take, and even your daily routines are sending signals to your brain. Whether those signals are helpful or harmful depends on how well you understand your own body and make informed choices. Using garlic the right way, choosing the type that matches your health condition, and listening to your body. These are the first steps to keeping your memory, clarity, and sense of self alive and well. But here's the truth, garlic is only one part of the much bigger picture. In reality, dementia often begins with early warning signs that most people overlook. Have you ever forgotten a familiar name? Misplaced items more often? Struggled to find the right words? These may seem like normal aging, but sometimes they're not. That's why I invite you to watch the next video. 10 early signs of dementia you should never ignore. In it, I'll walk you through subtle changes, small moments, that may be your brain's way of quietly asking for help. Tap the video next to this one or find the link below. Don't wait until it's too late to care for your mind. I'll meet you there for a journey of awareness, prevention, and deep self-respect.